Have you ever suspected that you picked up a cold or a flu in the doctor's office? Have you ever awakened from surgery in extreme pain? Have you ever had a loved one in the hospital who fell as a result of being unattended? These are all common occurrences in medical care settings. According to the Agency for Healthcare Research and Quality, there are between 1 and 25 falls per 1,000 hospital days, and 51% of those falls result in injury. I want to bring these events to your attention because I believe that each patient must come to their healthcare provider armed with confidence to insist that each action of their provider is in their specific best interests. So today I would like to persuade you to be prepared to speak up for your own or a loved one's protection in 3 healthcare settings: at the doctor's office, in preparation for a surgical procedure, and in the hospital. There are no hard statistics for how many patients contract an illness in the doctor's office, but there is no question that you are exposed to infectious microbes there. Some preventative actions you can take are bringing your own reading material or a toy for your child, bringing sanitary wipes for the arms of the chairs, and hand sanitizer for you and your loved ones when you're ready to enter the exam room. Also, do not be afraid to ask your physician's assistant to wash their hands or any equipment that they may be using to take your vital signs. And if you are very sick and feel particularly vulnerable, please explain this to the desk attendant and ask to leave your cell phone number to be contacted when it is your turn to enter the exam room. The next setting is surgery preparation. As with any treatment, the patient is encouraged to come prepared with questions. It is a good idea to ask the surgeon how often he or she performs this procedure and their opinion on its benefits. And do not think that it is inconvenient to ask to speak with other patients that have already experienced the same procedure. There is a website called leapfroghospitalsafetygrade.org that evaluates hospitals on each surgical specialty and what their weaknesses and what their strengths are. This gives a unique insight into a hospital's track record and statistics on their surgeries. Some surgeons can work in more than one facility, so please give your preference for what facility you would like to have your procedure done if you have one. Lastly, there is a risk of injury in surgery that is not given enough airtime, in my opinion. It is normally the surgeon's direction, what he knows about your physical condition as to how he positions you for surgery. But especially if your surgery is more than 2 hours long, you can suffer from nerve damage or pressure point injuries, sort of like ulcers that you would get in skin breakdown if you were in a nursing home. So according to the study done by the National Center for Biotechnology Information, 12% of their participants acquired injuries from positioning during surgery. That included pressure point pain and nerve damage. Especially if your surgery will be 2 hours or more, please discuss with your surgeon what your known joint pain or your limitations physically are that would not be obvious from what the doctor already knows in your chart. Then, in conjunction with that, is post-operative pain management. There are greatly increased regulations on opioids that are the best pain-relieving agents. It is not uncommon for a surgeon to begin another surgery immediately after yours is completed. Yet, your post-op caretakers try to do their best to communicate with that surgeon if there are any complications after your surgery. There are many options in pain management, and it is much better to communicate about these options with your provider before you wake up in pain or the surgeon is already preoccupied with another patient's care. So I would encourage you to ask many questions about what their pain management options are after surgery and also during surgery. There are besides anesthesia, the traditional anesthesia that would be intubated, there are also options called blocks, sort of like an epidural that women have when they're going to have a baby, that just block pain from the waist down. They can do that in an extremity as well. But there are also risks of it not working also that you may not be aware of or be able to make an informed decision in the moment unless you get educated about it ahead of time. As far as post-operative pain options, there is a self-administered pump that can also be installed before the wound is closed that could be discussed before surgery. And if you are not willing to use an option like that, you could also just discuss his approval for extra strength acetaminophen or ibuprofen if that is something that you prefer to take after surgery. So finally, the hospital stay. Having the help you need after surgery is imperative. First, I encourage you to arrange to gather your support and have friends and family with you in the hospital at a minimum of 3 days. A surgical site infection is the most imminent threat to your recovery, according to the Surgical Infection Society. Movement is also on the top of the list for helping patients to recover. But moving after surgery is never comfortable, and it requires many strong hands. In 2008, Medicare ceased to reimburse hospitals for increased costs and hospital days due to falls. It is greatly encouraged for patients to do as many self-care activities as possible after surgery, but there is often no one available to assist with those activities. So in addition to the support team that you rally to help you after surgery in the hospital, please make it a strong point with the caregivers in your hospital room that you or your loved one are not to be left alone in the bathroom or when doing any standing activities. And if you could also not be afraid to ask that you or your loved one be checked on every hour. You are there for 24-hour care, so please don't be afraid to ask that someone check on you as frequently as you feel necessary so that you feel safe and able to do the activities that you need to do to take care of yourself immediately after surgery. If you feel that your care is negligent in any way, you can report this to your state Department of Public Health. And there is also an empoweredpatientcoalition.org that you can file complaints with. The alternative to not being prepared in these situations is to leave all your decisions to your provider, placing all the direction of your care in the lap of whomever is assigned to you at that moment, without knowing what your physical or emotional or mental capacity may be in those situations at that particular moment. So in closing, I hope that I have persuaded you to be prepared to speak up for your own or a loved one's protection in these 3 healthcare settings: at the doctor's office, in preparation for a surgical procedure, and in the hospital.